Ladies and gentlemen, we are standing at the edge of one of the greatest transformations in human history, a moment where technology is no longer just a tool, but a partner in saving lives. For centuries, healthcare has depended on human knowledge, experience, and intuition. Doctors studied for years, researchers worked tirelessly, and yet, despite all progress, millions still suffer from diseases that go undetected, untreated, or misdiagnosed. But today, everything is changing. Artificial intelligence is entering the world of healthcare, and it is not coming slowly. It is revolutionizing everything. Artificial intelligence is rapidly reshaping the way diseases are detected, understood, and treated, marking a turning point in the history of healthcare. For decades, diagnosis has depended heavily on human observation, experience, and limited data, which often led to delays or errors that could cost lives. Today, AI introduces a new level of precision by analyzing vast amounts of medical information in seconds, uncovering patterns that would be nearly impossible for the human brain to process alone. This shift is not just about speed, it is about fundamentally improving accuracy and enabling earlier intervention, which can dramatically increase survival rates and improve quality of life. One of the most powerful applications of AI in diagnosis lies in medical imaging. Advanced algorithms can examine X-rays, MRIs, CT scans, and other diagnostic images with extraordinary detail, identifying subtle signs of disease at stages when they are still invisible to doctors. In conditions like cancer, early detection is often the difference between life and death, and AI ability to catch abnormalities sooner is changing that equation. Instead of waiting for symptoms to become severe, healthcare providers can act proactively, beginning treatment at the earliest possible moment and reducing the overall burden of disease. Beyond imaging, AI is transforming how doctors interpret patient data. Modern healthcare generates enormous amounts of information, from electronic health records to lab results, genetic profiles, and even data from wearable devices. AI systems can integrate all of this information into a comprehensive view of a patient's health, revealing connections and risks that might otherwise go unnoticed. For example, by analyzing trends over time, AI can predict the likelihood of conditions such as heart disease or diabetes long before they fully develop, giving patients and doctors the opportunity to take preventive action. Treatment itself is also becoming more precise and personalized through the use of AI. Traditional approaches often rely on standardized protocols, where patients with similar symptoms receive similar treatments. However, every individual is biologically unique, and what works for one person may not work for another. AI enables a more tailored approach by considering a patient's genetic makeup, lifestyle, environment, and medical history to recommend therapies that are specifically suited to them. This not only increases the effectiveness of treatment, but also reduces the risk of side effects and complications. In the field of drug discovery, AI is accelerating progress at an unprecedented pace. Developing new medications has traditionally been a long and expensive process, often taking years of research and testing before a single drug reaches the market. AI can analyze chemical compounds, predict their interactions with the human body, and identify promising candidates much faster than conventional methods. This has the potential to bring life, saving treatments to patients more quickly, especially in times of global health crises when speed is critical. AI is also enhancing decision-making in clinical settings. Doctors are often required to make complex choices under pressure, balancing multiple factors and uncertainties. AI-powered tools can provide real-time insights, suggesting possible diagnoses, highlighting risks, and recommending treatment options based on the latest medical evidence. This support does not replace the expertise of healthcare professionals, but strengthens it, helping them make more informed and confident decisions. Another important aspect of AI in healthcare is its ability to continuously learn and improve. Unlike traditional systems, AI models can evolve as they are exposed to new data, refining their accuracy and expanding their capabilities over time. This means that the quality of diagnosis and treatment can keep getting better, adapting to new diseases, emerging trends, and changing patient needs. It creates a dynamic healthcare environment where knowledge is constantly updated and applied. The impact of AI extends beyond hospitals and clinics, reaching patients directly in their daily lives. Mobile applications and wearable technologies powered by AI can monitor vital signs, track symptoms, and provide early warnings when something is wrong. This empowers individuals to take a more active role in managing their health, shifting the focus from occasional medical visits to continuous care and prevention. At the same time, the integration of AI into diagnosis and treatment raises important challenges that must be addressed. Ensuring the accuracy of algorithms, maintaining patient privacy, and avoiding biases in data are critical concerns that require careful attention. Trust is essential in healthcare, and both patients and professionals need confidence that AI systems are reliable and ethical in their operation. Despite these challenges, the potential benefits of AI in transforming diagnosis and treatment are undeniable. By combining advanced technology with human expertise, healthcare is becoming more proactive, precise, and patient-centered, opening the door to a future where diseases are detected earlier. Treatments are more effective, and outcomes are significantly improved. The future of healthcare is not a story of machines replacing humans, but of humans becoming stronger, smarter, and more capable through the support of artificial intelligence. For generations, doctors have carried the immense responsibility of diagnosing illnesses, making critical decisions, and saving lives, often under intense pressure and with limited time. Despite their expertise, they are still human, which means they can experience fatigue, cognitive overload, and the natural limits of memory and attention. AI steps into this reality not as a competitor, but as a powerful partner that enhances human capability and allows healthcare professionals to perform at their very best. In modern medical environments, the volume of information a doctor must process is overwhelming. Every patient brings a complex combination of symptoms, medical history, lab results, imaging data, and sometimes genetic information. Keeping track of all these variables while also staying updated with the latest research and treatment guidelines is an enormous challenge. AI systems can process this vast amount of data instantly, organizing it into meaningful insights that doctors can use to make faster and more accurate decisions. Instead of spending valuable time searching for information, physicians can focus more on understanding their patients and delivering effective care. One of the most significant advantages of combining human intelligence with AI AI is the reduction of errors. Even the most experienced doctors can occasionally miss subtle signs or overlook rare conditions, especially in high-pressure situations. AI can act as a second set of eyes, continuously scanning for patterns and anomalies that might not be immediately obvious. When a physician makes a diagnosis, AI can cross-check it against thousands or even millions of similar cases, providing an added layer of confidence or suggesting alternative possibilities. This collaborative approach leads to more reliable outcomes and increases patient safety. AI also supports doctors in making complex decisions that involve multiple variables and uncertainties. In fields such as oncology, where treatment plans can vary widely depending on the type and stage of cancer, as well as the patient's individual characteristics, AI can analyze global data and recommend the most effective options based on evidence. However, the final decision remains with the doctor, who considers not only the data, but also the patient's personal circumstances, preferences, and emotional well-being. This balance ensures that healthcare remains both scientifically advanced and deeply human. Another area where human and AI collaboration shines is in time management and efficiency. Doctors often spend a significant portion of their day on administrative tasks, such as documenting patient records, reviewing reports, and managing workflows. AI-powered systems can automate many of these routine processes, reducing the administrative burden and freeing up time for doctors to focus on what truly matters: patient care. With more time available, physicians can engage more deeply with their patients, listen to their concerns, and build stronger relationships, which are essential for effective treatment and healing. The integration of AI also opens new possibilities for continuous learning and improvement. Medicine is constantly evolving, with new discoveries, treatments, and guidelines emerging all the time. AI systems can stay updated with the latest research and instantly make that knowledge accessible to healthcare professionals. This creates an environment where doctors are not only supported in their current decisions, but are also continuously learning and adapting to new information. It enhances their ability to provide cutting-edge care without requiring them to manually keep up with every development. Importantly, while AI excels at processing data and identifying patterns, it lacks the emotional intelligence that defines human interaction. Patients do not just need accurate diagnoses and effective treatments. They need empathy, reassurance, and trust. A doctor's ability to communicate, to understand a patient's fears, and to provide comfort cannot be replicated by a machine. This is where the human element remains irreplaceable. AI can provide the insights, but it is the doctor who delivers the care in a way that resonates on a personal level. Collaboration between humans and AI also helps bridge gaps in healthcare systems around the world. In regions where access to specialists is limited, AI can assist general practitioners by providing expert-level insights, improving the quality of care available to underserved populations. This does not eliminate the need for skilled professionals, but amplifies their reach, allowing them to impact more lives than ever before. As this partnership continues to evolve, it becomes clear that the goal is not to create a system where technology dominates, but one where it supports and uplifts human ability. Doctors remain at the center of healthcare, guided by their knowledge, experience, and compassion, while AI works alongside them as a powerful tool that enhances precision, efficiency, and understanding. This combination creates a future where healthcare is not only more advanced, but also more humane, driven by both intelligence and empathy working together in harmony. As artificial intelligence becomes deeply integrated into healthcare, the conversation is no longer only about what technology can do, but about what it should do and how it should be guided. The power of AI to analyze sensitive medical data, influence diagnosis, and shape treatment decisions introduces a new level of responsibility that cannot be ignored. Healthcare is one of the most personal and sensitive areas of human life, where trust is essential and any misuse or misunderstanding of technology can have serious consequences. This is why ethics and humanity must stand at the center of this transformation, ensuring that progress does not come at the cost of dignity, privacy, or fairness. One of the most pressing concerns in the age of AI is the handling of patient data. Modern AI systems rely on vast amounts of information to function effectively, including medical histories, genetic data, and real-time health monitoring. While this data enables more accurate and personalized care, it also raises critical questions about who owns this information and how it is protected. Patients must feel confident that their private details are secure and used only for their benefit. Without strong safeguards and transparent policies, trust in healthcare systems could erode, making people hesitant to share the information that is essential for their own treatment. Another ethical challenge lies in the potential for bias within AI systems. These technologies learn from existing data, and if that data reflects inequalities or gaps in representation, the outcomes produced by AI can unintentionally reinforce those disparities. For example, if an algorithm is trained primarily on data from certain populations, it may be less accurate when applied to others, leading to unequal quality of care. Addressing this issue requires a conscious effort to ensure that datasets are diverse, inclusive, and representative of the global population. It also demands continuous monitoring and improvement to identify and correct biases before they can impact real patients. Transparency is equally important in building trust between humans and machines. When AI systems make recommendations or assist in decision making, healthcare professionals and patients alike need to understand how those conclusions are reached. A system that provides accurate results but cannot explain its reasoning creates uncertainty and hesitation. Clear communication about how AI works, what data it uses, and what its limitations are helps ensure that it remains a tool that supports human judgment rather than replacing it blindly. The question of accountability also becomes more complex in an AI-driven healthcare environment. When a machine contributes to a diagnosis or treatment decision, it can be difficult to determine who is ultimately responsible if something goes wrong. Is it the developer who created the algorithm, the institution that implemented it, or the doctor who relied on its recommendation? Establishing clear frameworks for responsibility is essential to maintain confidence in the system and to ensure that ethical standards are upheld at every level. Beyond these technical and legal considerations, there is a deeper human dimension that must not be overlooked. Healthcare is not just a science, it is a relationship built on empathy, compassion, and understanding. Patients often face fear, uncertainty, and vulnerability, and they look to healthcare professionals not only for solutions but for emotional support. While AI can process data and provide insights, it cannot replace the human connection that is at the heart of healing. Preserving this connection is crucial as technology becomes more advanced, ensuring that patients continue to feel seen, heard, and cared for as individuals. There is also a broader societal responsibility to ensure that the benefits of AI in healthcare are shared equitably. If access to advanced technologies is limited to certain regions or groups, it could widen existing gaps in healthcare quality and outcomes. Efforts must be made to make AI-driven solutions accessible and affordable, allowing people from all backgrounds to benefit from improved diagnosis and treatment. This includes investing in infrastructure, education, and training so that healthcare systems around the world can adopt and use these tools effectively. Ethical leadership plays a vital role in guiding the future of AI in healthcare. Policymakers, researchers, and industry leaders must work together to establish standards and regulations that protect patients while encouraging innovation. This balance is not easy to achieve, but it is necessary to ensure that technological progress aligns with human values. Continuous dialogue, collaboration, and reflection are needed to navigate the challenges and opportunities that arise as AI continues to evolve. Ultimately, the integration of AI into health care is not just a technological shift, but a test of our collective priorities. It challenges us to define what kind of future we want to build and what principles we are willing to uphold. By placing ethics and humanity at the forefront, we can create a system where technology enhances care without compromising the values that make healthcare meaningful, ensuring that progress serves people in the most responsible and compassionate way possible, but one where doctors and AI work together, combining the power of technology with the heart of humanity. This is our opportunity to build a world where healthcare is smarter, faster, and more accessible than ever before. A world where fewer lives are lost and more lives are saved. The future of healthcare is here, and it is not just artificial intelligence, it is augmented humanity. Thank you